Racial disparities is something that has become more prevalent during the pandemic. Dr. David Hicks with the Jefferson County Health Department joins us tonight to talk more about the impact this pandemic is having on the African American community. Good evening, and thanks so much for joining us tonight.
Oh, good evening.
How is the current surge in cases affecting the local Black community?
Yeah, so in Jefferson County, we're not experiencing the dramatic disparities that other parts of Alabama are, but certainly we do have grave concerns. Particularly, African Americans are being found to be sicker and higher rates of death, and particularly in more of the rural parts of the state. Jefferson County, we're kind of blessed that we're not seeing those dramatic disparities, but it's still a big concern.
And the health department, as you know, released some demographics earlier this year regarding the virus. Now, has the ratio of cases among African American Alabamians compared to other races changed at all?
Yeah, so in Jefferson County, the ratio has been remaining steady, but there are some data points that we just don't have where when someone goes to the lab, they may not be declaring their race. So we do have some holes in some of the information, but the national data and the statewide data does reflect definitely the disproportionate burden of disease in communities of color.
So after months of treating COVID-19 patients, African American patients, what has the medical community learned about this virus and specifically how to treat Black patients?
Yeah, so the disparities that we're seeing, we're talking about it now with COVID-19, but this predates COVID-19. The African American community particularly is more burdened with heart disease, diabetes, lung disease. And then we know that for COVID-19, African Americans are disproportionately in jobs where they cannot social distance like other fields. They're disproportionately the frontline workers. And so COVID-19 presents a challenge when we recommend social distancing. But if you're at work and you can't do that, that puts you at increased risk. And then we know that there's structural discrimination issues and things historically that has been at place. When you add all those things together, that puts people of color at a higher risk, kind of a competitive disadvantage. And so we have to do more tailored messaging to the community to let them know what these risks are, to understand what the situation is, how to access the health system in a more meaningful way, and engage in the community to really get the proper messages out there.
And for you tonight, talking to our viewers, what is your message to them? What is your message to African American Alabamians? What do they need to know about this disease and the important things that you suggest in protecting themselves?
Yeah. So, first of all, this is very serious. This is not a hoax. There's been myths that's been circulating in certain communities that this is not going to affect you. There's been myths saying that if you allow somebody to get a test done, they're actually injecting you with in COVID-19 and never get a test done. There's also some stigma issues where if someone gets COVID-19, some people in the community are making it seem as if it's something they did to bring it on themselves. And so the issue is know the facts, trust the reliable sources, the health department and our medical professionals, take this very serious and do all the steps that we've recommended with the social distancing as much as you can. We need to wash our hands and do all those things that we've already recommended. So the recommendations we have are not particular to any racial group, but there's certain groups that have to pay extra special attention and maybe work even harder to try to adhere to those recommendations. And we're actually engaging with our faith leaders in the African American community and those trusted stakeholders so they can actually help deliver the messages. So if there's testing in your community, because there's been a lot of efforts now with a lot of our community partners to provide testing in African American community, you have to go get that test done. Don't shy away from it. Get the test done so you know how you can protect your family members and loved ones.
Important information. Thanks so much for your time and insight this evening. Dr. David Hicks with the Jefferson County Health Department.
You're welcome.